Hi, my name is Dr. Ash Nayati and I'm a clinical neuropsychologist from Melbourne, Australia. And what clinical neuropsychology means is that I have training in brain function and how it impacts on our behaviour. I've also got a background in clinical research and I'm making this video to share some insights with you when it comes to deciphering medical and scientific research. Now, you've probably heard about the gold standard of scientific research, which is the double-blind, controlled, randomized trial. Now, the technical terminology is not that important. What's important is what that means and why it's considered the gold standard. This sort of research is particularly useful when it comes to evaluating drugs and the effectiveness of pharmaceutical products. So in a double-blind randomized controlled trial, what happens is participants come into the study, they're randomly allocated to either an experimental group who's taking the drug or to a control group. Now, in the control group, they're either taking nothing at all, maybe like a sugar pill or a saline injection, which we refer to that as a placebo, or maybe they're taking a drug that's already on the market, maybe from a rival drug company. So what that does is it compares the experimental drug to a baseline. So we can determine the effectiveness of that drug in comparison to doing nothing at all or in comparison to the rival drug. It's really important that when participants come into the study that they're randomly allocated to one of the treatment groups, because as you could imagine, if all participants share really similar characteristics and they're all put in one group, then it could affect the outcome. So think of like a weight loss drug. If all of the obese and overweight BMI participants were put into one group and all the participants with a healthy or underweight BMI were put into another group, then it would artificially inflate the results or it potentially could obscure the findings. So having random allocations to groups and having a control group as a comparison group is really important. So what does the double-blind part of it mean? So sometimes what can happen is when people are taking a substance that they know is a pharmaceutical product, there can be effects due to that person's bias. So, and as well, when an experimenter is evaluating the results of the study, there can be some bias inherent there. And this is not to say, this is not, some kind of like malingering or malicious sort of bias. It's just the bias that comes from being human. If we know that the person we're looking at is taking a particular drug, then we might be more likely to view them a certain way. So a double-blind study means that neither the participant nor the experimenter knows which group the participant is in, and it's only later on that it's discovered, okay, the substance that they were taking was the experimental drug. Now, how does this relate to research about parenting and behavior management and other sorts of therapies? So, as you could probably imagine, it can be quite difficult to apply this gold standard across the board to all scientific research. Like if you're doing, let's say, a sleep training method, then you probably know which group you fall into because you're doing the sleep training. So it could potentially be really difficult to have a double-blind study. That doesn't mean to say that any research that doesn't conform to this gold standard should just be thrown out. There are different levels of scientific research, and I think all science is valid as long as we're aware of things like how participants are allocated to groups. Is it randomized? Or maybe like in a sleep study, you would find that all participants in the sleep study are experiencing sleep difficulties. So knowing the allocation of people into groups is really important. Knowing whether there is a comparison group, and if so, what is that comparison group comprised of? Is a comparison group taking a placebo or taking an experimental type of therapy? Are they doing an experimental therapy? Are they doing a rival therapy? Are they using some kind of treatment or technique that is already practiced or is already on the market as a baseline for the new therapy? These are just a few things to think about whenever you're evaluating the robustness and the rigorousness of a scientific study. Like I said, there's no bad study out there. And in fact, in most research papers, you'll find a section in there called limitations, where the scientists themselves will actually highlight areas where their research methodology may have had some gaps in it, like the fact that the participants were not blind to which treatment group they were in. So having a good look at that limitation section of a research paper can be really useful. And of course, using your own critical eye when it comes to evaluating scientific and medical research. I really trust you found this video helpful, and please feel free to make contact with me if you've got any questions about this. Obviously, this is a really big study. Obviously this is a really big area. Scientific studies are a huge topic, and there's definitely a lot to cover, and this is just the tip of the iceberg. So I trust you found this useful, and I really appreciate you watching this. My name's Dr. Ash Nayati, clinical neuropsychologist from Melbourne, Australia.